Hannah, and I'm the chair of the International Relations Committee of the American College of Surgeons. It's 8 a.m. in Chicago, and today's webinar is about the American College of Surgeons Academy of Master Surgeons, Surgeon Educators, Advancing Surgical Education internationally. It's my absolute privilege and distinct honor to moderate this webinar. My guests include three iconic academic surgeons who will provide an overview of the Academy's mission and goals with a specific focus on the benefits for international fellows of the American College of Surgeons. My distinguished guests include the co-founders and co-chairs of the steering committee of the Academy, Drs. L.D. Britt, our president of the college from 2010 to 2011, amongst many other accomplishments, and Dr. Ajit Sachiva, the director of the Division of Education for the college. My third guest is the master surgeon and educator, well known to all of us, Sir Mary Brennan, also an Academy steering committee member. In addition, we have three distinguished Academy members and associate members, Dr. Andrea Parker from Kenya, Professor Shintamonti from India, and Professor Smith from Sydney, Australia, who will provide some perspective on their experience joining this and serving the Academy's mission. For our audience, you have the opportunity to ask questions through the chat function. Without further delay, let me start by asking Dr. Britt to provide the welcoming remarks. Dr. Britt.
Thank you, Dr. Hannah. First, let me applaud you for your leadership. The American College of Surgeons was founded in 1913, but the Academy was not on the blueprint. I have to give Dr. Sachiva credit for being the founder and the architect for this. The purpose, there's 7 purposes or charges. One, it is honorific, but it's a living institute. It helps us to predict, to establish and implement necessary educational paradigms to face the challenges. One challenge we faced when the Academy was first started was the COVID pandemic. But also we need to extend it globally. And this is the purpose of this initiative. At the end of the day, there's no sustainability of a country where the cornerstone is not education. And our obligations and obviously responsibilities will be to participate, will be to advance this initiative by science, not faith-based, but by science, and to disseminate and do outreach initiatives and to be an advocate. And with that said, we need to also underscore the importance of mentorship in the Academy internationally. So I want to thank you. I want to thank Dr. Sachiva and Dr. Hannah. Thank you so much.
Thank you very much, Dr. Britt. Dr. Britt has another commitment, so he will sign off for now. My next guest is Dr. Sachiva, who's going to tell us a brief history and goals of the Academy. Dr. Sachiva.
Thank you very much, Dr. Hannah. It is a real privilege and honor for me to be part of this webinar. Clearly, the Academy is interested in international outreach and international members, and all this makes this session even more important. To step back a little bit, the Academy was established in 2017 following approval from the Board of Regents based on a proposal we submitted from the Division of Education. And it was a very enthusiastic response of the Regents. We set up the steering committee, and the steering committee created the model. We sent out notices asking for applications for member and associate member categories. And the first cohort of members and associate members was inducted in 2018. Now, the members are a lifelong recognition in that once you're a member for life. And that is the highest of the high achievements of a master surgeon as an educator and as a clinician who's made a big difference. The associate member category is one where people are on their way, but they haven't quite reached that ultimate pinnacle. And the associate members are people who are doing scholarly work in education, teaching, doing curriculum design, but they really are not at that member level yet. That's a 5-year appointment, after which they can reapply for another 5 years as associate members or apply for member if they are ready for that application to be reviewed, or they can basically go and do other things if they are not interested anymore, because there are people in the associate category who are at the retirement age, and they really wanted to contribute a little bit in the last 5 years of their careers before they moved on. We added the category of affiliate member the following year in 2019, and that is intended for non-surgeons, non-fellows of the college. And that category includes engineers, people from industry. We have very, very well-renowned people in that category, some professional PhD educators and the like. So those 3 categories of membership continue, and every year we accept applications. The steering committee looks at the applications very objectively based on standards and criteria, and we select people. There are no fixed numbers. We can have as many or as few members as qualify, and there is really no obligation for us to make sure that certain regions or certain specialties are covered, although we would like all the specialties to be engaged, which we've been very successful in doing, and we certainly like international members to be involved. So just very quickly, as Dr. Britt mentioned, this is more than an honorific group. We've been making headway across different fronts. During the pandemic, we did a lot of work addressing the training needs of surgery residents and fellows during the pandemic and the needs of the faculty and residency programs. We had a number of publications come out of our work. There was a lot of enthusiasm, a lot of excitement, worked very well. We have virtual grand rounds that are held every other month. And the next one actually is this Thursday evening on competency-based education with special focus on EPAs. And the American Board of Surgery is going to be heavily involved in that. And that's always at 7 p.m. Central Time. We also have fireside chats with experts and luminaries who share their perspectives with the group of attendees, and these are open to anyone who wants to join, and it's a very informal dialogue. We have a listserv to exchange ideas, and coming back to the engagement of members, last year we had a symposium here in Chicago prior to the induction ceremony, where we had a symposium on how to engage members better. That symposium came up with great recommendations, and we have a task force working through those recommendations so we can engage members even better. And of course, we have the International Outreach Task Force headed by Sir Brennan, and he'll talk a little more about that. And that group is engaged in recruiting and supporting members from across the world. So it really is a privilege for me to be with you. I'd be delighted to answer any questions during the Q&A period. And we are so thrilled to have 3 members of our academy from different parts of the world join us today. So thank you very much, Dr. Hanna. I'll turn it back to you.
Thank you, Dr. Sachiva, for this nice review for the history and the goals. We're going to move on to Sir Brennan. Sir Brennan is a steering committee member of the Academy, and he's going to tell us a little bit about the activities of the Academy Task Force on International Outreach. Sir Brennan.
Thank you, Mr. Chairman. Again, thank the committee for the invitation. I think we need to acknowledge that there are really 3 communities of international medical graduates that we address in this country. There are those like myself and others on the panel today who came as an international medical graduate, were trained here, and were fortunate enough to stay. The responsibility to those people is predominantly of the college itself, not of the academy. The second group, of course, is there are 120,000 residents in training in this country, and 25% of those are international medical graduates. That number in surgery is about 20%. The majority of those will stay here, and they become predominantly the responsibility initially of the board and then of the college. The academy, however, has an international responsibility to those outside the country. And in the main, the members that come to the academy internationally are highly distinguished and experienced educators. We initially thought that we would have trouble recruiting those people and would have to actively recruit them. That has not proved to be so. We have seen some remarkable high level and high quality people from around the world who are interested in the goals of the academy. They are uniformly dedicated to training of young people, but dedicated predominantly to training young people either in their own country or in this country with the intent for them to return. That latter group essentially has to be fellowship programs, because if people come here in residency program, the high probability is that they will stay. The challenge then is not so much for us to recruit people internationally, but how do we deliver something to the people who are in the academy, who work in other parts of the world? Excuse me. That is a challenge, and I'll look forward to recommendations from the International Relations Committee as to how we might best do that. One of the features that's very prominent is that there are a large number of fellowship programs open to international medical graduates in this country at a fellowship level. To my knowledge, there's really no formal categorization of those opportunities, and they vary extremely widely from institution to institution. We have an active program in Nigeria, which we call the Global Disparities Initiative. It includes various parts of Kenya, but that's designed on the ground education. What the academy needs and what we need in terms of help from you all is how do we best serve the international members of the academy? As Dr. Sachiva mentioned, the last thing we want is this become solely an honorific group. That truly won't happen. What we not want is recognition based on contribution, not recognition based on desire. So I will look forward very much to the discussion that follows. We should acknowledge that other colleges, particularly the Royal Colleges, are way ahead of us in terms of their contributions in other parts of the world. And I believe that we can learn from them. We're fortunate to have as one of the consultants on the academy, James Garden, who is very active in the activities of the Edinburgh College and has contributed significantly. We need to, as an academy, look to the international membership with the goal of how do we best serve them, or more importantly, how do we best allow them to help us and them to grow. So that's my 5 minutes worth, Dr. Hannah, and I look forward to the discussion.
Thank you very much, Sir Brennan. You certainly bring up important points, and we'll look forward to the question and contribution from our international fellows on the webinar on what they see, how the IRC and the Academy and the American College of Surgeons can help increase the membership of the Academy. I'm going to go on to our guest speakers as well, who are members of the Academy. In the particular order, I'm going to start with Dr. Andrea Parker. Dr. Parker is actually practicing in Kenya. She does a great job with surgical education. She is a member of the Academy. And Andrea, tell us a little bit about, how did you know about the Academy, and how was the application process, and how did you end by being a member?
Yeah, thank you so much for having me as part of this webinar. It's a great honor, and it's a tremendous honor to be part of the Academy. So I became I'm an associate member. I became an associate member in 2021, and I actually heard about it. Got an email from the college, kind of talking about this, and I thought, man, this is what I want to. This is a big part of my work and practice, and this seems like getting together with a group of like-minded individuals. And in my mind, I was really looking for opportunities for networking, for mentorship, to kind of glean just tips, advice, thoughts, experience from those who have gone before in this process of surgical education. So it's been great. I thoroughly enjoy being a member of the Academy. So there's a little bit of background. I work, as was mentioned, in Kenya. I work in Western Kenya in a rural setting at a faith-based mission hospital called Tenwick. We are part of the Pan-African Academy of Christian Surgeons, and then also the College of Surgeons of East, Central, and Southern Africa. And so we have training programs at our hospital in surgery-wise, specifically in general surgery, orthopedic surgery, neurosurgery, most recently then OBGYN, and fellowship training in cardiothoracic surgery. So we do a lot of training, but I think one of the things that I have observed and experienced as I've lived and worked here for 8 years now, is that I think that this is similar to maybe historically what was the case in the United States as well, but it's certainly the case here, is that the assumption, and sometimes even the expectation, is that because you trained to become a surgeon, you are automatically qualified and equipped to be an educator. And so we struggle with that. And so a couple of years ago, we actually conducted a needs assessment here in Kenya, asking members of COSEXA and the Surgical Society of Kenya, who are educators, what their needs were. And it was just suffice to say that faculty development is a huge need across all areas of what we saw. From teaching in the wards to operative teaching to assessment and feedback, to curriculum development, anything that you can imagine that falls under the umbrella of surgical education. The people that I work with and who work in this region were saying, we just need help. We need help learning these things and how to better educate. And so that's something that I really hope we can, as we seek to work together as international educators, that can be a part of the initiatives of the International Relations Committee and the Academy together. So I'm happy to take any questions.
So Andrea, thank you for your insight. You're in Kenya, and a lot of folks, we hear from the IRC, a lot of folks talk about, some of perhaps they get intimidated about the application process and the requirements, especially from low-income countries. What do you say to those folks? They somehow intimidated? They think it's kind of difficult to achieve that level that perhaps is much easier we do in the US or Europe. What's your response to that?
Yeah, so I would say I also was intimidated and really felt like this is a long shot, probably not going to get accepted, but I'm gonna go for it. So it is a bit of an intimidating process, but I think that all of us who are working in education have things to share, and I think that I would be happy if people reached out to me, those in low and middle income countries who are interested in applying and maybe want some help with the application, or some thoughts in terms of how to best present themselves to the committee. And I think anything that where we maintain quality, there's going to be some level of a bit of maybe an intimidation factor. That's okay. Just put yourself out there. And I think that the Academy is very interested in having people and representation from all parts of the world. And so just go for it. And I'm happy to help.
Okay, thanks, Andrea. I'm sure I'm seeing questions coming up on the chat, but I'm going to kind of collate them at the end and move forward with the discussion. Let me move to Professor Chintamani from India. Professor Chintamani, tell us a little bit about your experience and how did you leverage your membership in the Academy, and how did you help your folks in India, one of the biggest chapters for the ACS, international chapters?
Well, thank you very much, Mr. Chairman. It's truly been an honor to be a member of the Academy. I joined the Academy in 2021. And since then, I've been very actively observing the activities that happen, especially some of those that were mentioned by Dr. Sachiva, virtual grand rounds, the fireside chats, and especially about the residency program related issues. Although our residency system is a slightly different one, and it may not be exactly that you can replicate what you hear, but to a great degree, having been involved as an educator in the field of surgery for both the science and art of it, the last 25 years in the Tertiary Teaching Care Center in Delhi, probably the largest, one of the largest. So it really helped. And the second thing that it did was I could bring it to my chapter. And ever since then, many members have applied, many surgeons have applied for associate membership or for the membership. And it was truly a joy to be spreading a word around that it's certainly worth it. Besides being an honor, it also is a place where you can actually share both your information and ignorance, which I think is a very important part of it, the surgical educator. The issues that pertain to training, especially in this part of the world, are related to the structure of training. And although we are a very large country, and as you very rightly mentioned, arguably one of the largest chapters, international chapters of the college, we are very blessed in the sense that for the last 6-7 years, almost every year we get about 150 plus affiliates joining it, and each one of them is very, very keen on getting involved in the surgical education field. So that's where it probably helped. And in the last meeting, we have actually introduced some of these programs of the Academy in our own chapter, and I've done that especially in my own college. And it has truly helped. And the feedback, you can always tailor it to your situation. The situation isn't exactly the same as Sir Brennan was mentioning about the training program, people trying to go to US to get fellowship and stay on. But there are a lot of international fellows who are keen on just getting the training and getting back to their own country. That's where this can truly help. And we've been able to motivate a lot of them to be very actively involved in becoming the members and the associate members, etc. Lastly, what it has done specially to me personally is to understand more about something that I've been doing for all these years, dealing with not only the postgraduates. I think the surgical training or the induction into surgery should start right when they're medical graduates. So we have taken that leaf out of what Sir Brennan was mentioning, that their induction shouldn't be the end of it. They should be part of that system where gradually, as you introduce them to the training program of surgery, more and more people opt for surgery. For last few years, surgery is gradually becoming the fourth or the fifth choice. It used to be the first choice in our country. Now, the reason for that was probably, I thought, was personally observed as being due to the educational system. We are a very large country. High volume is our advantage, but also our problem. The problem is that to provide structured training in every nook and corner of the country, we are trying to take the footprints of the college to every little corner of the country. So we are observing that this structured training program that we can certainly utilize in making our training system better and giving it to our fellows and also the fellows in the making, as I mentioned. We have made lots of undergraduates as affiliate members of the college just to get them introduced to the concept of surgical training. And it has made a difference. And we are preparing a document to actually submit it as a publication that it can make a difference. If a medical student, right when he starts his career as a medical student, if he's introduced to the concept of training in surgery, he is interested. So a lot to take from it. And there are a few areas which obviously may not be absolutely replicable in our scenario, but we can certainly tailor it to make it useful in this part of the world. So overall, I'm truly honored and blessed to be part of, to be a member of this academy. And we have many other associate members that have become of late in the last year and a year before last year. So we are trying to encourage more and more people to join. Thank you very much for all these programs that happen very actively, and we are always involved in them, especially the virtual grand rounds. They really are very much appreciated by at least our chapter, and we have started this on the same note at, locally at our place. So thank you very much. I'll be very happy to take any questions or comments. Thank you.
Thank you, Dr. Chintamani. Appreciate your insight. Let's move on to Professor Jonathan Smith from Sydney, Australia. Dr. Smith, tell us about your experience joining the Academy and how you're helping our international surgeons in Australia become members, and what do you see the benefit? And then we'll have a more informal discussion and some numbers to share. And I'm sure there's a lot of questions for Sir Brennan and Dr. Sachiva as well. I see a lot of questions coming up in the chat.
Thank you very much, Dr. Hanna. It's a privilege to be a part of the webinar. My involvement with Academy members goes back a long time. It's in fact 1999 when Dr. Sachiva came to Australia as a faculty member for our Surgeons as Educators course. And that was the foundation of a very active group of surgical educators in Australia and New Zealand. And I became a fellow of the college shortly after that, and was also president and governor of the ANZ chapter, and became well aware of the Academy, and was fortunate enough to be an inaugural member, and went to the ceremony in 2018 to be inducted. And since that time, I've been lucky enough to maintain a very active engagement. I was privileged to join the special committee of the Academy, looking into issues related to surgical education and training during the pandemic. And that was an extraordinarily rewarding experience. I was privileged to give a presentation to the committee about the impact of the pandemic on surgical education and training in Australia and New Zealand. And it was a great opportunity for us to have some cross-fertilisation of ideas and approaches to the pandemic. I was also privileged to be on Sir Murray Brennan's task force, and we grappled with many of the issues that are being discussed tonight. For Australia and New Zealand Fellows of the College, we also have our own Royal College, and that does create some difficulties regarding recruitment for the Academy, because busy surgeons often rely on a small number of opportunities for education, and our Royal College does provide a very broad suite of educational opportunities. But there are a very dedicated band of surgeons who are very much linked to American surgery and the college. I was fortunate enough to train at Stanford University, and I've maintained long contacts in that area and really have a good feel for American surgery and what it can offer. And so I try and recruit some Australian and New Zealand surgeons on a regular basis for the Academy, and also try and identify surgeons in the Asia Pacific region who may be suitable as international associates or members. But I think our contribution, being a more wealthy part of the world, is the sharing of ideas with the Academy, and that's something we certainly value. So thank you for the privilege, and I'll be happy to take any questions.
Thank you, Professor Smith. I think the webinar so far has certainly have a lot of people interested. A lot of question is about how to apply and join the Academy. So on the we have put up in the chat box the website for the Academy, so you can actually visit that. The Academy has an application online process. I think it's accepted application through April 28, 2023, and we have the web address in the chat box as well. So for our international fellows who are joining the webinar, you can certainly go ahead and visit the website and you can apply online. I would like to share a slide real quickly, if I may, just to show some numbers. Let me see if I can successfully do that. Can everybody see the slide?
Yes, it's not in presentation view, but it's viewable.
You can see it. So this is just a show. This is a presentation I gave to the executive committee of the ACS last year. And I just want to show how the numbers of the ACS International Fellow has increased over the years. Right now, the International Fellows represent approximately 13 to 14% of the total ACS Fellows. So clearly, there is quite an interest in becoming members of the American College of Surgeons. And certainly the IRC has made a concentrated effort to increase the membership over the years, just to reassure the international fellows their importance of their participation, and that the fellow is interested in becoming a global kind of figure for all surgeons to improve quality and patient care. Let me ask Dr. Sachiva. Dr. Sachiva, people are concerned from low and middle income countries. They might not have the several required qualification. Is there any specific advice you would give those international fellows in low and mid income countries? What should they focus on when they're applying for the membership?
The standards are the same regardless of where you're applying from. But as we look at each application, we make sure that due consideration is also given to the context where people work. So it's not a cookie cutter model, and we can customize the decision-making process to the applicant. So we would be happy to work with you if you have interest and you're not sure how to present those achievements. Quite often, it's not the lack of achievements or the lack of meeting standards, it's the way things are presented on the application from the work that has been done. So we'd be happy to work with you. We'd be happy to ask someone to look at your application if you like, and to assist in any way possible. And Carolyn Roth, who's on this call, who had posted the website address, she's more than happy to bend over backwards to help anyone interested. Thank you. And I'm happy to talk to anyone as well.
Thank you, Dr. Sachiva. I want to share another screen to reassure our international folks and surgeons about the Academy and how it's actually is interested in getting international fellows to be members. Can you see my slide?
Yes, it's viewable.
Okay, so this is a number of the Academy Master Surgeon Educator of the total number. You can see that the total number of international fellows in the Academy as of 9/30/22, that's at the end of the clinical, before the end of the clinical congress last year, was about 14%. So it's very similar to the number of international fellow members was in the ACS. So clearly the Academy has made a concentrated effort in having our international surgeons become members. And I've listed here the countries represented, and I'm just going to list them to make sure that people know that it's a variety of countries from all over the world: Argentina, Australia, Brazil, China, Hong Kong, France, Greece, Haiti, India, Italy, Jamaica, Ireland, Japan, Jordan, Kenya, Mexico, Nigeria, Qatar, Rwanda, Saudi Arabia, South Africa, Spain, United Kingdom, and United Arab Emirates. So you can see the world is really well represented. That he was in the Academy of Master Surgeon Educator, and you can see over the years from 2018 to 2022, the number of international members have increased. And certainly give credit to Dr. Sachiva and the steering committee member in reviewing the application and certainly inducting international fellows. Dr. Sachiva, any comments on these numbers that I just presented?
Thank you, Dr. Hanna, and we really appreciate you presenting the numbers and the variety of countries. And as is very visible, we have people from high resource countries, people from middle and low income countries. So it's a great mix. And I think the diversity of representation offers us a very unique opportunity, because I think the needs of people in different parts of the world are very different. Professor Chintamani mentioned that in his comments. And I think what we need to do is to figure out what the local needs are. So we are not really using a single approach, we're using many different approaches, with the folks who are from those countries being our champions, and the members from those countries being the point people who can really get the word out. So I think these numbers are very telling, and we are so delighted to have the broad representation we have in the Academy, and we are hoping that it continues to grow. Thank you.
Thank you, Dr. Sachiva. So I'm seeing questions, seems more coming from low and mid-income countries about getting letters of recommendation for a variety of reasons that sometimes be challenging just because there's no enough fellows to offer recommendation within the chapter, or perhaps they don't feel that they can give recommendation for new members. So letters of recommendation seems to be an issue, also becoming members of the ACS. Any suggestions on how to overcome lack of ACS fellows to provide letters of recommendation in low-income countries?
Thank you, Dr. Hanna. I'll jump in, and perhaps Brennan might want to add something as well. One of the beauties of our model is that it is grafted on the college's membership model. So for full membership and associate membership, you have to be a fellow of the college. And in applying for fellowship in the college, there are recommendation letters and reviews that are part of that whole process. So my suggestion would be go back to the people who recommended you for fellowship in the college or who interviewed you locally, and those would be your best resources. And if you're still running into a roadblock, let us know, and we'll find someone who can either work with some local people who know you or can provide some additional advice as well.
Thank you, Dr. Sachiva. Sir Brennan, you mentioned about fellowships available to international surgeons. You know, this is one of the topics that international surgeons and the chapter leaders and governors bring all the time. And one of the questions is there an organized process on how the international surgeons can find about these fellowships, and what would be the process?
The short answer to that question is no. What we've proposed before the Academy is that every single institution in this country has international fellowships of one sort or another. But there's never been a collation, to my knowledge, of those. The individual has to go to the organization, like our own, go to their website and look for international fellows. We've had international fellows for 35, 40 years and longer, but they're not published. So one of the opportunities for the Academy is to begin a process, and we've discussed this with Dr. Sachiva, of actually putting together the potential opportunities for training in this country at the fellowship level, because those people already have a faculty appointment. They will return and make the difference that Dr. Parker was looking for. Obviously, I'm pleased that Dr. Chintamani likes the virtual webinars. That's good. My concern remains not so much about the people that are going to join the Academy, but what we do for the people internationally who are in the Academy. So the two questions I would ask, one of Dr. Parker, she is looking for faculty development. How do we do that? And the second question, Dr. Hanna, is for you. If 13% of our current members of the college are international medical graduates, how do we harness that diaspora to give back to the countries they came from?
Thank you, Sir Brennan. Great two questions. I'll give chance to Dr. Parker to answer the first question, and I'll respond to your issue about the IRC. And thank you for bringing that issue up, by the way. It's a great question. Andrea?
Yeah, thank you. I appreciate the acknowledgement of that. I think there are just so many opportunities, and I think So the college, the academy have tremendous resources, both human infrastructure, in terms of curricula that can be shared. And I think one of the things I think about our upcoming Surgical Society of Kenya meeting, and we have several through the International Relations Committee, several quality improvement gurus, I guess I'll say, experts in the field coming and doing the ACS quality improvement course with 25 selected medical students, residents, attendings from Kenya. And that is then just an incredible opportunity for those of us who live and work here. I think similarly, we could start to see some of these initiatives related to faculty development and using the members of the academy who would be interested in traveling various places and taking topics that would be of interest to various local educators who work in low and middle income countries and doing things like that. I think about every year, COSEXA and the American College of Surgeons partners heavily with COSEXA, and many fellows of the college come and help out with our board examinations every year. And at that annual general meeting is, again, a tremendous opportunity to put on workshops and talks related to surgical education, using experts in surgical education to give opportunity to our local educators. So those are a couple ideas that I would say are just ripe for opportunity.
Before you answer, Dr. Hannah, one of the problems, we have our institution, myself and Peter Kim, have a major investment in a program for global disparities in Nigeria. It's NIH funded, it has grants, it does clinical trials, it has an African research group in oncology. But beyond our own institution, very few people know about that. So one of the challenges, Sach, I think for us, is to collate these activities, but more importantly, collate the opportunities. And I think the Academy could do that well. And that relates to the second question, Dr. Hannah. How do we involve the international diaspora to do, a college diaspora, to do more for the countries from whence they came?
Yeah, thank you, Dr. Brennan. Sir Brennan, that's absolutely a strategically important question. So in the last few years, the IRC has had the same question concern you had. So we started trying to convert, the clinical congress from a once-a-year event for international fellows to a year-long opportunity. And some of the initiative that the IRC has taken is advocate for more of our international fellows to be participant in the clinical congress as moderator, as speakers, and submitting of course, proposal for the program committee. The COVID era kind of invited a lot of folks to start webinars. So we have designed several webinars in the last couple of years geared towards international fellows in terms of building the career, he for she series, encouraging women surgeons to be more active. And certainly the scholarship department, in collaboration with the education and the IRC, continue to provide a lot of scholarships. I think you're absolutely correct that, for example, I didn't know anything about the global, project you have in Nigeria, and that certainly would have been quite helpful if the IRC has known about that. So there's some communication that certainly the IRC can help improve and deliver this back to our international fellows. We encourage the international fellows to have their own webinar. We made commitment to the local governor and chapter leaders that we would sponsor the webinars, encourage local speaker from the region, as well as US speakers if desired, and we would actually do the logistic for that. Another idea we entertained, and I think it's in development, is to have what we would describe as the best of the clinical congress and held this conference outside the US, and hoping this will come to light maybe at the end of this year or maybe next year. Certainly we are open for suggestions. A lot of folks in international fellow are interested in educational opportunity. So I think the international fellowship you spoke about is important. and perhaps the Academy would take the initiative in collating this information and making it available to the IRC, and we certainly communicate to our fellows. Looking at some of the chat questions, they mentioned, surgeons and low-income country in particular don't do a lot of education simply because they were not trained to be educators. One question I would pose to the Academy, the steering committee and leadership, how can we, improve the teaching capability of our international fellows to become actually educators? Is there a program that you foresee that the IRC can sponsor or help initiate, and how to make it that sustainable, based on also some of the program that Dr. Parker had developed in Kenya?
I'll take a little bit of a stab into that question, Dr. Hannah. I think from our perspective, we have a one-day course at the Clinical Congress for those who attend called Surgical Education Principles and Practice, which is really a teaching course for frontline teachers, teaching in the operating room, teaching in the outpatient clinics, teaching at the bedside. And it is a very practical one-day experience based on the Surgeons as Educators course that Professor Smith talked about earlier. And so that's one piece. Now, I know the opportunities to come to the Congress are limited as well. And I'll come back to an idea that I have. The second is our flagship Surgeons as Educators course that we had the privilege of exporting with the Royal College's help to Australia. And we worked together on that. And I had the distinct honor of being one of the 5 faculty members who got that going with the educators of the Royal College. And it's kind of just taken off. We just went there and got it going, but it's really Professor Smith and other educators who have done wonderfully well to get the course to the next level as Surgeons as Educators Australia. Now, beyond that, we also have a certificate program for educators who don't want to pursue a master's degree. That is probably harder for people from low and middle income countries to participate in. It does require a presence once a year ×2 over here in Chicago for the beginning and end of the course to present the work at the end and to get the certificate. The rest of it is all virtual. But beyond that, what we are thinking about is taking some of the modules of the one-day course from the Congress and making them available online to people. And that would help with the dissemination to some extent for the frontline teacher. The problem I have with that is that we all know if you look at a video or participate in a virtual session, it raises awareness, it helps to build some knowledge, but it really does not build the skill set, which requires hands-on activities. So we need to partner with people locally and regionally all across the world to make that hands-on experience come to life. And we would be delighted to partner with, say, the Royal College in Australia, the Royal Australasian College of Surgeons, to see how we could distribute some of these activities in that part of the world. We could do the same thing in India and South Asia. We could do the same thing with Dr. Parker in East Africa. And we have now people who are in the academy from Nigeria. We could do the same thing for West Africa. So there are opportunities of that type. We also have some members from the Middle East who are not represented here, but they are very active in dialoguing with us, and we could reach out to them, and certainly in Europe, Western Europe as well, and Canada. So I think if we divvy up the world in different geographical areas and then come up with a model that works, that could be customized locally, that may be a way to achieve the right goals. Thank you.
Dr. Sachiva, thank you for your explanation and answers. And I have a question, follow-up question, but I'll give a chance for Sir Brennan to respond for further comments. Sir Brennan. You are muted, Sir Brennan. Thanks.
Thank you. I hesitate to introduce this, but I believe one of the greatest challenges for surgical training and education in this country is that the fact that clinical care is now disease-based, not discipline-based. It's no longer driven. 30, 40 years ago for solid tumors, when surgery was the only option, it was easy for surgeons to lead. Currently, if you don't have a knowledge-based training, whether it's in vascular surgery or anything else, then we will fail. And that's a real challenge because the patient is looking for someone who can manage their disease, not necessarily provide a technique. Now, with every challenge, there is great opportunity. And I think it's a fantastic opportunity to train our physicians and surgeons here to lead that process. The risk within the United States is that we will give up that and revert to the technicians dominated by the use of the robot. For the rest of the world, that's not the current solution. So we have to think, as many do in Nigeria. Many surgeons give chemotherapy. Many surgeons do all the many of the investigations. We have to look at how we refocus care in its broadest sense to the disease. That's a great opportunity, I think.
Sir Brennan, you always bring new ideas to the table, and certainly that would be a challenge. I'm seeing several questions. It looks like mostly coming from low-income countries. Is either questions of what are the surgical educators? What's the role and how to be trained? And certainly the follow-up question, coming to the U.S. is quite expensive in this era of economic difficulty and uncertainty. How do we, and this reminds me of clinical trials. We used to do clinical trials at the mothership hospitals of any academic institution. Now we actually bring the clinical trial to local community hospitals to encourage patient and increase number of patients participating in clinical trial. How can we do this for our low-income countries? How can we bring our resources to them? Is it all virtual? Can the college, have, similar trips like we talked about, Dr. Sachiva, to different parts of Africa and the Middle East to try to educate the surgeons to be surgical educators, and also same issue for research?
I can perhaps answer that to some extent. We are constantly approached about doing clinical trials in other parts of the world. The problem is not the clinical trial. The problem is the infrastructure. And the infrastructure for the clinical trial is almost exclusively dominated by the FDA. And so they provide what we call. Now, Rick Pazder, the director of the FDA, involved with the World Economic Forum, involved with Mr. Biden's moonshot, is looking with his Chinese compatriots to try to standardize approaches to clinical trials, particularly in the relation of informed consent and particularly in the relations to providing the infrastructure. That works fantastically well if you have an in-country clinical trials group. Probably the finest group that I've been involved with is CTONG, the Chinese Thoracic Oncology Group. They have an enormous infrastructure. And if you read those journals in the New England Medicine, they're obviously, the trials in the New England Journal, they're often supported by them. So the clinical research, the research activities, it's not our problem, it's the infrastructure problem, and it's the regulatory problem, all of which we are actively working on.
Thank you, Sir Brennan. Dr. Sachiva, any further comments on that question?
Yeah, I have two comments that I'd like to make. I think as we look at the educator, the word educator and teacher are quite often used interchangeably, and we look at them very differently. We have written an article, and that has really spun off a lot of activities of people working at and being recognized at 4 levels: teacher, master teacher, educator, master educator. And our academy looks at the pinnacle, the master educator level for members coming into the academy, and the educator for the associate members. But there's a huge group of teachers and master teachers who are frontline teachers who've never been taught teaching in a true sense. They've been taught surgery, they're great surgeons, but they are sometimes not as good teachers. So I think we need to look at that in a different light based on the level. We can certainly have some online modules, as I mentioned before, and then perhaps set up partnerships or collaborations with regional groups where we could look at more rigorous training at the higher levels of that pyramid that I described at the 4 levels of achievement. So that's just a thought for us to think about as we go forward. Thank you.
Thanks, Dr. Sachiva. We have 5 minutes to go, but so I'll ask the last question that comes also from probably low-income countries. To become a member in the college, there's tiered pricing for joining the college, and the questions come to the cost of educational materials and attending conferences. Is there any plan to have tiered pricing for various educational materials and attending conferences for international fellows, especially from low-income countries?
For the Congress this year, we are going to have 3 levels of registration. The 3 income levels based on the IMF classification. So there will be discounts given. Previously, we used to do that on an ad hoc basis, and we're going to formalize that a little more going into this. In addition to that, we have done the same thing in discounting the membership fees for the academy based on the country people originate from. Many of our programs are free, and some of them we are looking at a tiered financial structure. The issue that we have to deal with, frankly, is that for the high-end, very interactive and resource-intense programs, especially the ones that involve technology and simulation, etc., those are pretty expensive to maintain. So we have to, at the end of the day, pay the bills and pay the vendors who house these programs for us. So we are trying to make some adjustments there, but the room there is a little bit less to work with just because of the high expense side that we have. But we are absolutely cognizant about the challenges, and we would be delighted to talk with people and try and work out solutions on a case-by-case basis. Thank you.
Thank you, Dr. Sachiva. Just to point out for our international fellows, the IRC has published 2 online free books that are available. The gastrointestinal and surgical emergencies, which was well perceived and has been downloaded over thousands of times from many, many countries, as well as Practical Guide to Managing Breast Cancer as well. So the IRC website have a lot of educational resources. I would encourage our international fellows to actually access those resources. We're coming to the end of the hour. I'll give the last comment to Sir Brennan and Dr. Sachiva. Sir Brennan, your final word.
Well, as is evident from what we're doing right now, a major part of future education is going to be online. And one of the opportunities for the Academy and the college and the IRC is to document what's available online. We now have a system in our own institution that if you've been an international fellow here, or any kind of fellow, you've gone through all the HIPAA requirements, you can then leave, return to the country you came from, but have ongoing access to all of our disease management discussions, all of our webinars. That's available. The problem is, how do we give that to the rest of the world? And I see that as a real challenge. I believe we could populate a textbook just by the number of opportunities available to international graduates of any kind in how they get educated. But I do want to leave with this concern that greatly worries me. The care of the patient is progressively disease-based. And if surgeons don't take the opportunity to lead that, not just become technicians, we all have a great problem. Thank you very much for including me.
Well said, Sir Brennan. Well said. Dr. Sachiva, final word.
Yeah, I think this has been a wonderful session, and looking at the numbers of participants at the bottom of my screen, clearly people have stayed. So this has been of great interest. The questions have been phenomenal. We've got some great ideas that have come up as a result of this discussion. And perhaps I would suggest to Sir Brennan in follow-up when we have our next meeting of the International Outreach Task Force, we invite, in addition to the task force members, some of the folks who are from the Academy who have participated on this call and this webinar, Professor Smith, Professor Chintamani, and Dr. Parker, plus Dr. Hannah, you might want to join us for that discussion so we can debrief a little bit and see how we can take this forward. But I think this is the beginning of a whole new set of discussions that will go forward. And I'm very pleased and optimistic, and I think there's a lot of opportunity ahead. So thank you so much, Dr. Hannah and the IRC staff for organizing this. I think it's been a phenomenal session. And thank you all for participating.
Thank you, Dr. Sachiva, and IRC definitely would love to participate on that effort. It's 10 o'clock. I'm grateful to all my distinguished guests and our viewers for sharing time and their thoughts. Have a blessed day and goodbye.
Thank you.
Thank you.